This video is intended to help you prepare for the dissection of the fetal pig. The first thing you will need to do is gather all your materials. You will need a dissection tray, your dissection tools, which include scalpel, large scissors, small scissors, tweezers, blunt probe, dissection needle, and pins. You will also need 2 lengths of string, some paper towels, a large Ziploc bag, and your fetal pig. When you get back to your workspace, make sure that you have 2 pieces of string. This string will be used to tie your fetal pig open so that you will be able to work more easily and see the internal structures of your pig more clearly. Place the string under the dissection tray, then tie one end of the string to one of the front feet of your pig. Make sure that your string is long enough to fit all the way around the outside of the dissection tray, and that you will have enough string on the other side to tie the other end to the other front foot of your fetal pig. Once you have completed this process for the front legs, repeat it to tie to the back legs of your fetal pig. Your fetal pig should now be ready for you to begin your dissection. Using your scalpel, very carefully make one continuous cut from between the front legs of your fetal pig all the way down to between the back legs, making sure to cut around the umbilical opening. Then make a lateral cut under the front legs. Using a tweezer will help you hold the tissue. Very carefully use your scalpel to open the body cavity and expose the internal organs of your fetal pig. Remember that you will be using the same fetal pig for your laboratory investigations for the next several weeks. Be careful not to cut so deep that you damage or remove any of your fetal pig's internal organs. Once you remove pieces from your fetal pig, you can't put them back. You may find that once you open your fetal pig, that the odor of preservative is very strong, or that there is extra latex inside the body cavity, restricting your view of the internal organs. To fix this, take your fetal pig to one of the sinks and carefully rinse it out with water. You should be careful to make sure that you are not flushing any pieces of tissue down the sink drains as you do this. When you are finished rinsing your fetal pig, you may want to remove excess water with a paper towel. In order to more easily see the internal organs of your fetal pig, many of you will want to remove the tissue from outside the body wall. This is easiest to do if you use the large scissors. Remember to be careful what you remove so that you do not take anything that you will need in later dissections. You should continue to follow the instructions in your lab manual to identify the structures for today's laboratory exercise. When you are finished with your dissection, you should spray your fetal pig with Ward Safe. Then cover it with damp paper towels that you've dampened with additional Ward Safe. Then remove your pig from the dissection tray. You can leave the strings tied to the legs of your fetal pig, as you can use them again next week during your dissection. Carefully place your fetal pig inside a large Ziploc bag with your name and section number on it. Don't forget to clean up after you complete your fetal pig dissection. Place your fetal pig in its labeled Ziploc bag into your sections bin for storage until next week's lab. Then make sure that you wash and dry your dissection tray and all of your dissection tools so they are ready for the next lab. Please wipe up any messes or spills in your work area, and make sure to dispose of any fetal pig tissue in the bucket at the back of the room. Fetal pig tissue should not go down the sink drains or in the trash.